I am Community Chloe of Radio One Richmond Stations, and welcome back to Her Story RVA. It's Her Story RVA number 2 with Urban Baby Beginnings. Now, last month we talked about a lot of great stuff, and if you want to know what happened, all you have to do is go to our station's website and you can watch. Now, we're back with Stephanie. She's going to be joining us, and she also brought along two friends too, two very own doulas. The doulas with Urban Baby Beginnings, Nikita Upshaman and Candice McDaniel. How are you?
Hi, Miss
Hello,
Clovia. Good morning. How are you doing?
I'm doing great. So, Natika is a clinical herbalist and yoga therapist with experience advocating wellness for the whole person. Workforce development manager at Urban Baby Beginnings and community doula, and committed to deepening the skill sets of people who are passionate about providing supportive maternal child health care for all families. I love that. And Candice McDaniel, good to have you with us, a
Hi.
community doula with UBB, providing continuous physical and emotional support while educating and empowering families to have the birth experience they desire. As a mother of three, she firmly believes that doula care is not a luxury but a necessity for all birthing persons. Now, everyone that's joining us, we thank you so much. Now, we're going to get into this conversation centered around community doulas and the role they play in the community. So, I like to start the dialogue. Of course, Stephanie, I call you my expert. So,
Yeah.
can you tell us a little bit more about exactly what does doulas do and why UBB provides this type of community service?
Yes, absolutely. Certified community doula birth professionals, and they work with people during the pregnancy, postpartum, and childbirth period to provide physical and emotional support. And if you guys have been following our story over the many years, what we have really done is to try to create support structures and systems for moms. Because just like our experiences, we realize that people don't have the support and resources that they necessarily need to, and they're not accessible. And we've been just making sure that moms can connect with trusted professionals in their own communities.
Well, thank you so much for that, Stephanie. Now, as a doula, what are some things that you've experienced and the impact it has had for families? Let's start with you first, Natika.
thank you. So I feel like empowerment through knowledge and compassion really has been a driving force for families to feel strong in the adventure, the creative adventure that is building a family. So that's one of the things that really pulls me forward in the work.
Because when I think about a doulas, I didn't have one. But now it's common in our communities. And when we're talking about community doulas, exactly what does that mean, Candace?
So as a community doula, we are there to help the clients find their voice. I think in the medical profession, it can be a lot of intimidation
Yeah.
as a client listening to the medical profession. So definitely having those clients find their voice, being able to advocate for themselves, offering them that support while they are advocating for themselves, and basically experiencing what they desire.
Mhm. Candace, have another question for you. How often do you visit your patients and what does that visit look like?
So we do for prenatals, the birth, of course, and then for postpartum. But since relationships are so important in our work, it's a lot of communication in between those 4 visits. So a lot of Zooms, a lot of FaceTime and messages. We don't go too often without speaking with our clients and interacting with our clients, just making sure we're building that relationship.
Mhm.
Um, our initial visit is that longest visit. We're getting to know the client, knowing the client's desires, their fears, their wishes. They're getting to know me. I'm getting to know them. And all of
Yeah.
our subsequent visits do build upon that. Just seeing how they're doing, progressing, what they need, whether they need education or just that emotional support. We're there for that. We also make sure we do a full birth plan so we can know exactly how they want their birth to look. Since every birth can be different, do some comfort measures. We'll meet with their support, their family, partner, so they'll know, how they can best support them during that time when the woman is in labor, so she can focus mainly on having a healthy baby.
Oh, thank you so much for that, Candace. Now, Takika, I have a question for you. After the baby is born, is there any doula community support after birth?
Oh, absolutely. Urban Baby Beginnings is very much a village. So we like to
Okay.
wrap around each other and keep each other in community so that we can keep our spirits up and also help to share those experiences of what happened to you, what's going on with me. Can I use that little tidbit for my family over here? So we'd love to have community groups
Mhm.
afterward during the postpartum and also the prenatal experience so that there are mommy and me groups. We have breastfeeding and lactation circles and
Okay.
opportunities to share what you've had with folks who are coming up behind you and starting that first family on their own.
Mhm. Do you also have conversations about the mental wellness and the changes in your mind, soul, and spirit after giving birth?
Big part of what our
Okay.
community doulas do. And that conversation starts during the contraception phase and it goes on through the prenatal phase. We're talking about it in birth and then also talking about it with the family members, not just with the birthing person, so that everyone has an opportunity to understand what we're looking for. How can I be
Mhm.
supportive? And yes, we are regularly evaluating and helping our birthing people and families get the mental health support that they need along the process.
Well, I'm so glad that you're here because a lot of times when it comes to women, and in particular African American women, when something doesn't feel right, we're often not heard of. But when you have that doula, you can communicate every possible thing from, as you said, conception, birth, and then after birth. So thank you so much for that. And thank you so much, UBB, for being here. Do you have to be a member of UBB to have access to community doulas? Is it only for Richmond residents, Stephanie?
No, actually, what many people don't know is that over the past year and a half, the state and Medicaid has been pushing forward to ensure that those who are Medicaid recipients have access to doula services. And so Virginia became the fourth state across the nation to offer
Wow.
doula services to Medicaid recipients. And so we're really excited. So that means that across the state of Virginia, if you do have Medicaid, you do qualify for this service. And how to make sure that you're able to sign up for that service if you wish to have it.
And you touched on it, you may be eligible for the service, but what is the process of requesting a doula if you do have Medicaid?
So, a couple of things. One, you do need to engage with your provider just to let them know so that they can fill out a recommendation form. And it doesn't necessarily have to be your OB provider, it's someone. Recommendation form, you can find it on our website under our referral form. And you will take that to your provider, put it in your My Chart, something like that. So then that way they can fill that out. So that's one of the things that you need to do. The other thing is you need to find the support system that you wish to have. So if you come through Urban Baby Beginnings, you're going to submit a referral, and that's going to let us know that you are seeking doula services. And then we will work on the back end to match you up with a doula and also get authorization from your insurance company. So the process gets very easy after you go through those steps, but we're here along the way in the event that you have any challenges. And then lastly, I do want to say that if there is any confusion about what the service is or if you need to connect and are not sure what to do, the managed care organization, so all the Medicaid organizations like Optima and Anthem, they have care
Mhm.
coordinators in the pregnancy program. So you can also reach out to them and ask about what you need to do in order to connect with the doula, and they can help get you to us as well.
Stephanie, I have another question for you. You know, I'm always questioning you. What
Sure.
if you don't have health or medical insurance, but you still want access to a doula? Is there a process for that?
Absolutely. So we want to encourage everybody to get care as early as possible. And I hear a lot of times in the community where moms are waiting until they can get approved for Medicaid in order for them to get
Yeah.
care. And there are also programs that and clinics that provide clinical care regardless of insurance status. So what we really want moms to do is, you may be familiar with it already. You go on Cover Virginia, And Uncover Virginia allows you to apply for insurance. But then also we want you to reach out to your local clinic and or hospital, because they have prenatal OB clinics that may be able to help you as well and get you connected early on. So even if you're going through the process of getting a, you'll have people along that way that are able to help through that process through our perinatal access programs, which are in many areas in the Central Virginia area. So we don't want you to not seek care, and we don't want you to not connect with a doula just because you don't have insurance. Worst case, we want you to reach out to us, and we will let you know what to do. But you should, with the expanded, be able to qualify not only for, if it is just Medicaid, it might also be through the healthcare marketplace. We've got to talk through those things.
Wow. Stephanie, thank you so much for that. And for folks who are viewing us, and if you just want to support, just go to urbanbabybeginnings.org. That's urbanbabybeginnings.org. And I am so inquisitive. Natika, why did you become a doula?
Oh my goodness, that's a real trajectory. But I think it's really in my blood. It's in my DNA.
Oh.
My grandmother was a midwife and an herbalist, and I'm an herbalist by nature and nurture. So my concerns for women from menstruation to menopause have really been dear to my heart. I personally have experiences with excellent healthcare and supportive coordinators, but I also have experience with poor care coordination and neglectful practitioners. So I'm driven to really help others alleviate that experience. If I can help other people not be in harmful situations by understanding more and having the supportive person there with them when they are in the midst of birth and experience, so that there's another person to be there to support. That's really a huge benefit that we're offering to the community. And that's why I started this work.
Wow. Thank you so much for becoming a doula so we can save our babies. All right, Candace, why did you become a doula?
My own birth experiences also influenced my desire to get into this work. I had my first child. I was pretty young. I was 20. And although I had, full support, family, loving family and friends, it was oftentimes I felt alone and scared, uneducated about what was happening or what could happen. I had thoughts and desires of how I wanted things to go, but I didn't know that I could say to the doctor, I don't want this, or I do desire this. So that definitely fueled this desire and this interest in birth work.
Well, thank you so much for that, Natika and Candace. I appreciate that, because I think it's so important when it comes to all women, but in particular African-American women, when we talk about the less or reduction in care. And I think it's so important. So again, thank you for all you do. What is some advice you have for ones that could use the assistance and resources that UBB's doulas provide, but are a little hesitant to follow through with the necessary steps to request one? Let's start with you, Stephanie.
I would definitely say, and I think a lot of people are hesitant, and Candace hit on it earlier, because she said one important thing, that relationship building is so important. And when you don't know one, it's hard to trust them in such a sacred space. And, really, I think what's most important is just to, really evaluate where you are and kind of what it is that you desire. Remember to be that superwoman. And what I mean by that is you don't have to do everything alone by yourself and all of the things. And that leads to, I think, poor outcomes overall, not only mentally in terms of how you feel, but the stress that you carry in your pregnancy. And so my suggestion to people when they're trying to evaluate the care and support that they need is to put themselves first, and to remember that you're not meant to do this alone, and that there are a lot of people that are out here that are wanting to pour energy, positive energy and support and wellness and healing into your space. And you just have to take that first step, even if it may not be easy. Even just picking up the phone and talking to one of us can help you to make that decision for yourself. But in the end, we want you to make the best decision for yourself and your family.
All right, Stephanie. Candace and Natika, would you like to add to that?
Yes.
Okay.
Y'all gonna sing together? Harmonize. Go ahead. I see it. Let's start with you, Natika.
one thing that Stephanie said is really the most important piece, I think, to remember is that you're not alone and there are no stupid questions. We, as Urban Baby Beginnings community health workers, are here to help, and we're happy to do so. There is a relationship aspect to this, that we are asking you for information, we're asking you to be engaged, and we are happy to pour into you with all the years of knowledge and experience of all of our caseworkers and health workers. So please just come to us. Let us help you. You can lean on us.
All right. Thank you, Natika. Candace?
I would just say there is no shame. We do not judge you at all, whether it's your first baby or your seventh baby. We are here to support you and help you. And also, I think that our services are available for any birthing person. So you don't have to fit a certain box. You don't have to say, oh, we're not just for unmedicated births, or we're not for people that are just easy. So I do believe that anyone can benefit from doula services. So that's why it's just very important to reach out and see how we can support you. We're here to help you.
Wow. Healthy babies breed healthy futures, and that's what Urban Baby Beginnings is all about. For more information, you can go to the website at urbanbabybeginnings.org. Stephanie, thank you so much for coming on. Candace and Natika, it's been a great show. A lot of great information shared today. Now, this is for 2022. You're going to be back in 2023 for the new year, and you're going to continue the series of sharing resourceful information for our maternal communities. Happy holidays from our family to yours. It's